My name is Dima Hendricks, and I am a patient activist and advocate. So my patient story began when I was 6 months old. I was diagnosed with sickle cell anemia, and ever since my diagnosis, I've been in and out of the hospital battling with the disease. So my mother found out I had the disease through a babysitter. At the time, my mother worked at John Hancock, which is right up the street, big tall blue building, and my babysitter called her and said, you know, something's wrong with Dima. She's crying, she won't let me touch her, she's screaming, and this is generally a good baby. So my mother came home from work and brought me to Boston City Hospital, which is now Boston Medical Center, and that's where they diagnosed me to have sickle cell SS disease. And it was a learning curve for my mother because she didn't know exactly what sickle cell disease was at the time. Sickle cell disease is an inherited blood disorder, predominantly with individuals who are of African descent, Middle Eastern descent, and it's basically in the name, sickle cell. Your cells are shaped in a crescent like moon half shape, and they are sickled, and the blood cells can block in your veins and your major arteries and organs and cause pain, organ damage, severe crises, and many times I've had acute chest, I've had a stroke, I've had damage in my left eye, and I've been hospitalized on and off all my life because of effects of the sickle cell disease. My mother didn't know much about the disease, but she went and she educated herself. She sought after the top doctors in the area at the time, and I had probably still have one of the #1 hematologists in the Boston area, and with her help she educated my mother in transitioning me and the family through my diagnosis. Growing up with sickle cell disease it's a lot. So I was a child that grew up in a Catholic school environment, private school, and I would always be out. I would have jaundice because of yellowing of the eyes, because of the disease and my cells breaking down. I had a limited social life. I had bullies picking on me because I looked different. I felt different. I couldn't play with the other kids. So my life was very limited. My mother kind of sheltered me and protected me from the elements, and I didn't understand that world because I wanted to be just like any other kid at the time. And we were in an era of going outside and playing until the street lights came on. I was never a latchkey kid that was able to go out and run out and play. I always had to be inside and away from the elements. So it's very different. And then there was the whole hospital dynamic. As a pediatric patient, I was very sheltered, and I had a great relationship with the nurses. I had a great relationship with the hospital staff and the doctors. But I was always there, and it became my second home. There was a great child life experience. There was a great child life program available at the hospital, but my biggest transition happened when I had to transition from pediatric to adult, and that was very jarring and shocking for me. I became this cute little kid with a disease, with a chronic illness, to this drug-seeking black woman. That became a problem not only for hospital administration, but became a problem for the doctors who were treating me. So it was a very shocking and different dynamic, especially in the emergency room department. I went from having an advocate as my mother and my mother and the doctors advocating for me and being at my bedside to doing everything by myself. So it was a very hard transition. I had my prom in this building, and I had my whole prom on this floor, and I think my senior year was a great time for me because I felt what it was like to be an adult, and I got to experience all the novelties and the great things of high school. That was my best time, but as soon as I graduated high school, I felt it was a turbulent time because I went from having a great public school education where the nurses were able to help me and advocate for me in the public school setting, to now going to college and having the professors say, oh, you can't do your work. You're not here to do your work. I'm going to fail you. So it took me about 15 years from start to finish to get my bachelor's degree and complete my bachelor's. Now I do have a master's, but that was just the whole college experience was quite difficult because of the sickle cell. So I think the thing that changes during adulthood is other people's perceptions. It's not so much myself and who we are, anyone who's chronically ill. It's not really us that are changing. It's the perception of seeing a grown woman, and I'm not, on the PD floor, and I'm not cute and little, and so now there's this big perception of, why are you here? Are you here for drugs? Are you here for attention? What is your purpose to be here? Are you really in pain? Are you really feeling what you say you're feeling? So it's this whole dynamic of I'm not a baby anymore. I'm not a child anymore, and I have to be able to speak for myself, which is a hard thing to do, especially if you're in pain. When you're pregnant, of course you know, because I have 2 sons. When you're pregnant, when a woman is pregnant and they're giving birth, they can say, oh, she's giving birth, she's having a baby. At the end of it, she's going to have a baby. Great, but when you're having a sickle crisis, it's more painful than having a child, by the way. There's no correlation. It's just, oh, she's still standing, she's still walking, she's still talking, she's able to communicate. And they have these pain scales. Rate your pain from 1 to 10. And sometimes we can't articulate that because my pain threshold is way different from anyone else's pain threshold. So my 4 could be someone else's 10. So it's just a matter of perception on the medical community. And then another thing is, people still don't know to this day what sickle cell is. It's not something that, unless it's a specialty, like unless a doctor really goes in and specializes in blood disorders or hematology, that's when they'll find out what sickle cell is. And there's even some hematologists today that don't even know what sickle cell is. And that's sad. I make sure I don't come in begging for pain medication. The very fact that I'm coming to the emergency room period should tell you something, because I will wait till the last possible moment to go to the emergency room. I never tell my husband, oh, call 911, or my family, okay, call 911. They know if I say call 911 or it's time for me to go to the doctor, it's an emergency and I'm about to fall out. There are times where I will try to manage my pain at home, and I will continue to manage my pain until I cannot take it anymore. So for a woman who has a pain crisis and she's begging for pain medicine, that you need to listen to, because there's no way. Because of the stigma associated with the disease, we try very hard not to even go to the hospital. We rarely go to, sometimes we don't even feel like going to our doctor's appointments. So for us, being in the vicinity is alarming. You should pay attention. It doesn't even matter about the color because of where I am currently located. They treat all of us like that because of the atmosphere. In other places, like south of Boston or north of Boston, yes, people of color are treated as drug addicts and we're treated as predators. And I even went to a hospital where a doctor didn't even believe me. And I told him, sir, I'm having an acute chest crisis and I need this many pints of blood and I need this antibiotic and you need to admit me and I need to go to the ICU. He told me I have mono and I needed to go home. Gave me medication for mono and then I needed to go home. Of course, the diagnosis was incorrect and I went to my regular provider. In fact, everything that I said I had and that needed to happen. I think it's a matter of atmosphere, environment, a pretentious doctor with the doctor's hang-ups, the way we communicate, sometimes the way we communicate as patients. When we are in pain, we do come off a little testy. I admit it, but hey, it's like when a woman comes in, gives birth, she wants to rip her husband's head off. It's, we come off kind of, there's so many dynamics and so many things that are into play that we're not realizing the other person's viewpoint. And I think if we all take a step back and evaluate, okay, where is this person coming? Where's the doctor coming from? Where is, where the hospital administration coming? What's the bottom line? And how is this patient feeling? If we sit down at the table together and have this conversation, I think there'll be a little bit more room for an evolution. In terms of patient experience, I would like to see more patients at the table. Because it's not just about, I think doctors and nurses get it wrong sometimes, of quality education and quality training is just not about the institution. It's not about the professors. It's also about the patients that are teaching. And we're not just cadavers, we're people that are talking and telling and educating them because we are experts in our specific area of care. And there are times, yes, the doctors know more of the textbook language and the vernacular, but there's no way a doctor knows more about my patient experience than I do. And to get a sense of that, they need to sit down and have a conversation with me and include me as a patient, include me on decision making, include me in other treatments and other decisions regarding my treatment, include me in my treatment plan. And that's what patient-centered care and person-centered care is all about. As far as the societal change, it's all about lack of education, and we're very ignorant to each other's experience. Everyone has a story, everyone has an experience, whether it be a personal, a social experience, whether it be a patient experience, whether it be a regular old life experience. No one's going to understand how I feel if they're not open to hearing it. With my advocacy work, I would like to see healthcare providers, healthcare organizations to include us patients at the table. Hear what we have to say, make it a process of inclusion. I think that would be very beneficial. That's like my overarching goal for my work. I'm currently a part of the Greater Boston Sickle Cell Disease Association, where we promote advocacy, where we are a leading service provider for the Greater Boston area of sickle cell patients. We are connected through the Sickle Cell Association of America, and I am also the founder of the Through the Pain movement. It's a hashtag Through the Pain, and where I'm also in partnership with the Greater Boston Sickle Cell Disease Association. In addition to educating individuals about sickle cell disease, I would like to help patients in the hospital, because sometimes they don't have someone in the hospital with them being their advocate. Something as simple as a care package, something as simple as a good warm meal or a warm blanket will be very helpful and beneficial for patient care. But you can find me on dimahendricks.com for more information about Through the Pain. You can go to throughthepainmovement.com.